So thank you to those that are here today and also those that are listening. We will be hearing from Seth Brown, the contract lobbyist and director of government relations for the Iowa Medical Society. Excuse me. Seth Brown is a relationship-oriented, disciplined, and strategic-minded attorney and government relations professional who specializes in healthcare law, as many of you know. He leads our IMS advocacy efforts at the Capitol, and within his role, he educates on and represents the interests of Iowa physicians to state and federal lawmakers, regulators, and other stakeholders within the healthcare, legal, and health insurance spaces. Brown also oversees fundraising efforts for the Iowa Medical Political Action Committee, or IMPACT, and previously he served as the Director of Public Affairs for the Iowa Pharmacy Association, where he led IPA's advocacy efforts and focused on regulatory and insurance reform impacting pharmacist practice. During that time with IPA, he was sworn into the Iowa bar and still maintains his Iowa license to this day. Brown graduated from Drake University Law School, where he specialized in the legislative practice program. And as part of that program, he worked one session in the Iowa House of Representatives under Representative Bobby Kaufman, House District 82, and one session with Mr. Michael Triplett. That's all that I have to go over. I'm going to go ahead and hand it over to Seth to take it from there.
Thank you very much, Christina. I appreciate the introduction. I'll try to share my screen here. One moment, let's see. All right, hopefully everybody can see that. All right, so as Christina mentioned, I am the Director of Government Relations with IMS. I oversee all of our advocacy efforts, our PAC fundraising, and I do some legal and regulatory analysis as well. So all things advocacy all day long, all the fun stuff. I get to work with Christina, and she obviously puts on a great webinar, so I appreciate her introduction and setting all this up. I also want to say it is election day, so I hope everybody either has had an opportunity to vote or will be after this. It's really important that we engage in that way as well. If you have questions about that, let me know. I'm happy to direct and provide the information. So I have a pretty full agenda today. There's a lot that we're going to try to fit into a pretty short amount of time here. But I'll start with kind of an overview of IMS and what we do. I'll provide a broad legislative landscape overview, talking about who we work with in the legislature. And then I will also go into the legislative process and let everybody know where and how to engage, and then how to effectively advocate and engage. So we'll have a lot of content. I'll try to move through it quickly. If you have questions, let me know. I'm happy to stop and expand if we need to. All right, to kick it off, I will talk a little bit about IMS. IMS is the oldest and the largest statewide professional association for Iowa physicians. We represent about 6,000 physicians, residents, and medical students. And we help develop and help provide resources for medical professionals at all stages of their career and practice. A huge component of what we do is on the advocacy front, but we do have several other areas and key pillars that we engage on. Our ultimate vision is to be the leading voice in medicine, to make Iowa a premier destination for physicians to live, work, and serve their communities. And as I said, a key component of that is advocating through state laws and regulations. In addition to that, so in 2024, IMS, our board conducted a strategic planning campaign, and I listed out a few of the strategic priorities that our board identified as areas of focus over the next 3-year period. Big focus, workforce development, physician education and wellness, advocacy and thought leadership, which we'll spend most of our time in that bucket today, and then engagement and education. So there is a lot going on at IMS, but there's a lot going on in the legislature as well. So we are definitely active and very engaged in that way. According to our annual membership survey, our members of IMS identify advocacy as the #1 reason they choose to join IMS. And so I take that very seriously, and I know our staff really keeps that in mind as we're working every day. So moving ahead, I'm going to provide I'll call it an overview, but we're looking pretty closely at some of the players that we work with in the legislature and what the makeup of the legislature is currently. I want to start by providing this overview because to successfully advocate, it's really critical to recognize who the key decision makers are, their perspective, and then also any potential roadblocks they may need to overcome. We may need to overcome in advocating for our issues. So to illustrate this, I'll give some information on how the legislature operated last year, because it was illuminating. Also what bills IMS engaged on, especially in the public health space, and who the key players are going into next session. So as you probably have heard by now, it was an extremely active session. There were a record number of proposals considered and introduced at an extremely rapid rate. Overall, we saw 2,300 bills introduced. That is a lot. It's the most since about COVID era. But the total number of bills that ultimately passed the legislature or were actually enrolled was very few, 172. So that means that while a lot were introduced, a lot of those were defeated. But we do want to keep in mind that many of those are still active going into this next legislative session, which I think it's really key to have this conversation now so everybody's aware of what we need to keep an eye on moving forward. At the end of the day, only 170 were actually signed into law, and only 2 of those were vetoed. And so I lay all that out because despite the high volume and a lot of uncertainty going into session, we really did see a pretty successful year for healthcare, specifically for physicians, when we're looking at some of the priorities that we recommended and that ultimately passed. So to that front, 3 of IMS's priorities going into session passed, that being funding for residency slots, additional residency slots. The governor prioritized $150 million for new residency slots over the next 4 years. We also doubled the Rural Health Loan Repayment Fund and saw some streamlining of that program. And there was also an appropriation of $1 million to cancer research under the governor's bill. So that was all great and things that we recommended and supported. We also saw a bill that was 2 years in the making that would reform the prior authorization process and make it easier for physicians to take care of their patients. And so that bill also passed last year, which rounded out IMS's top 3 affirmative recommendations and priorities. And so while it is really important to bring those affirmative bills or introduce those bills that we're tracking that our members are telling us about, we also had to play pretty extensive defense on several public health related proposals. And I'm going to run through a few of these. They're not all of them, but they're the ones that we really tracked and engaged on the most and that we got the most feedback from members on. So the first one that I'll call your attention to is SF 180. This is the Refusing Medical Services Bill. It would essentially allow individuals who refuse certain medical treatment services ordered as a countermeasure under the PrEP Act to sue healthcare providers for several listed actions. And one of these actions, or 2 of these actions, were segregating the individual. And they use a couple different terms for that. But effectively, it would prohibit isolation and quarantine during public health emergencies. And so we did work with our partners, both in the lobby and also in state government, to educate on the impact this would ultimately have and how it would impact public health. The bill was successfully stopped prior to passing the House and prior to passing into law. So I say that we were able to stop the bill with a lot of grassroots engagement and help. But I do expect this bill to return next year, so we should be keeping our eye on that. In addition, we also engaged on 2 vaccine bills that were that caught the attention of a lot of our members. House File 712, a vaccine immunity bill being one. This bill removed federal liability protections for vaccine manufacturers that sell vaccines in Iowa. So this change would severely limit, if not altogether remove, access to vaccines in the state, because in our estimation, manufacturers just won't have the incentive to sell here if they don't have certain protections. So we did issue an action alert out to our physician members, asking them to engage with their legislators. And we were able to successfully stop that bill ahead of its passage just in time before the first funnel. The last one I want to hit on, SF 360. I'm guessing most of you on this call have probably heard about this bill or were tracking it during the legislative session. This was the mRNA vaccine ban. This is, as I said, one that our members really raised concerns over, probably the most of any bill that was introduced last session. This bill would have subjected physicians in Iowa who administer mRNA vaccines to a criminal charge and a $500 fine. And so obviously we had great concerns with that for many reasons, access to care as well as the criminalization of healthcare. So we heavily engaged on this bill. We asked our members again to reach out, and we saw a very successful response from our members to their legislators, leading to this bill being defeated before the final deadline. And so I do just want to take some time to say that a lot of these wouldn't have stopped if it weren't for physicians reaching out to their legislators and engaging in the process, which is why I think it's really critical that we educate on this and provide the tools to effectively advocate. One last note, we did stop a lot of these bills, but we can expect many of these to return because the Iowa legislature operates on a 2-year General Assembly, which essentially means that some of these will roll over and we'll have to stop them again. So please be vigilant. Please keep up to speed with IMS communications because it's something we are continuing to educate on throughout the interim and we'll engage on when session comes back around. All right, next I am going to provide kind of the chess pieces that we're working with in the legislature, who some of the familiar faces are and what the ultimate breakdown in each party is. And so I'd say many of you also know the House has a pretty significant Republican supermajority with 67 Republicans and 33 Democrats. So Republicans can essentially operate without any Democrats present because they can independently meet a quorum. That's what a supermajority in effect does. So it's important, I feel, to acknowledge the type of measures that the majority party will prefer and what they'll seek to advance. And we essentially have to work with the chess pieces we have and form relationships with those that are decision makers. And so to that degree, there are some very important decision makers that are new to their positions too on the House side. Majority Leader Bobby Kaufman is he's a Republican leading the House. He's from Wilton. And then Minority Leader Representative Brian Meyer, the Democratic leader in the House, are both new after the previous leaders vacated to run for other positions. And so we are educating these two. We're getting to know these two more and letting them know about our issues. But these are two key players in the process. In addition to that, we do most heavily engage with two committees as a healthcare organization. That's the Health and Human Services Committee, as well as the Commerce Committee. Health and Human Services, just as it sounds, all things healthcare. Commerce is all things insurance related. We have a lot of business and industry type proposals, as well as insurance reform that goes through the Commerce Committee. And so we do engage with that chair quite a bit. We have some new faces in these committees, one being Representative Austin Harris from Moulton, Iowa, Southern Iowa. I think will be really good at this position. He's a younger position though, and we have been meeting with him to educate. Familiar face with Representative Ann Meyer in the HHS Appropriations Subcommittee. She is a nurse by training and has been in the legislature for quite a while and is really educated on our issues, so it's good to have her in that position. And then lastly, the Commerce Committee Chair and Representative David Young, previous congressman, who has been great to work with as well. So we do have some familiar faces, and we will be engaging them quite a bit this next session as we address some of these public health related measures. On the Senate side, there's also a large Republican majority with 33 Republicans and 17 Democrats. Again, I'm just saying this because we do have to consider the type of measures that the majority party will advance or stop. The new face on the Senate leadership side is Senator Mike Klimisch from Spillville. This is coming after Senator Jack Whitford's decision to step down as he's battled his diagnosis with brain cancer. So Senator Klimisch has been very healthcare friendly, and we're really excited to see him in this position, as well as work with our two other people in leadership that we've engaged with quite a bit throughout the process. On the committee side, we do have a new face in Senator Carol Warmy as the HHS committee chair. Senator Warmy is married to a physician, and we worked with her a lot last year. This is her first full term, so that will be definitely a big step up for her, but she has shown that she does great work with healthcare providers, so we're excited there. We also have Mark Costello and Mike Buslow in the HHS budget subcommittee, as well as the Commerce Committee, respectively. And then quick note, everybody knows, I think the governor has decided not to seek re-election. I bring this up because as she leaves, there's kind of been a domino effect as different legislators vacate their positions to run for other vacated seats. So there is a degree of uncertainty and changing dynamics that we are taking into account in IMS. But I'd say that's all the more reason to get to know your legislators, because they're often moving up or to another position that impact us. So just a quick note of that. All right. Now I will provide a brief civics refresher for all of our participants to recall how the legislative process works and when you can engage in the process. I'll try not to bore everybody on this. I know civics was everybody's favorite class, but I will try to make it as fun and quick as possible. So as we're looking at the different branches of government, we have the legislative, the executive, and the judicial. The legislative is really the group that is writing the laws. They're elected by their constituents and placed in both the House of Representatives and the Senate. We also have the executive that is usually signing the bills into the law, but also implementing those bills once they pass the legislature. This branch also oversees state agencies like the Board of Medicine and others. And so we do call that out. We do work with them a lot in the advocacy process. When certain rules are proposed, that is where a lot of details can get fleshed out. And we engage with the Board of Medicine, the Department of Health and Human Services, and other groups like that quite a bit. So that is another aspect to advocacy that is often overlooked, but IMS participates in very actively. We also have the judicial. That's mostly kind of the post-passage legal review through the court system. So as we're looking at the branches for lawmaking, we're primarily dealing with the legislative and the executive, so the House of Representatives and the Senate on the legislative side. And so to become a law, essentially, can kind of boil down advocacy to this: an identical bill has to pass both chambers of the legislature, the House and the Senate, and then be signed by the governor. In effect, that's what we're trying to accomplish by the end of the day for bills that we're bringing, or we're trying to prevent that from happening for bills that we oppose. And so these are some of the specific steps required to go from a bill to a law. I don't want to get too far into the weeds on this because there can be a lot of back and forth. And it's never really smooth sailing once you get into the legislative process. So on the next slide, I'm going to walk through some of the key opportunities to engage on in the process. But in effect, there is an idea that is submitted to a legislator. That legislator provides that to a group that drafts the law within the state government. After that, the bill is filed and referred to a committee where it gets a subcommittee, essentially where the public can comment on it. After the public comments on it and those small group of legislators vote on it, it will be referred to a committee, which is a larger body of legislators. And at that point, they will again consider the bill and either decide to vote or not vote it out of committee. Once it's voted out of committee, it goes to the full House or the full Senate, the full chamber for consideration and debate. And once it passes one chamber, it has to start all of that over on the opposite side in the other chamber. And so with that, there are a lot of opportunities to engage, but I will say it's most effective to engage early on in the process when a bill is first introduced, or to nip it in the bud before a bad bill is introduced. If you can educate broadly on that, that does seem to help. So with that, an identical bill has to pass both chambers and then be signed by the governor into law, and her agencies that she oversees then implement that law. And so looking a little bit closer into some of the more of the specifics here, like I said, there is the drafting process when the idea is actually written into bill form. That's usually coming from either the legislator themselves, a trade group, or a constituent. And so IMS is often in charge and comes up with ideas to submit to legislators. Our prior authorization bill was a prime example of that, where we received feedback from members. They said, hey, this is an issue for us. You should review this and then submit it for a bill. We gave that to some of our champions in the legislature and they introduced it for us. After that, the bill then goes through a subcommittee. And this is really the opportunity for the public and for trade associations and the lobby to provide feedback on a specific proposal. We often bring our members in to speak to the specifics and potential impacts of a bill that's being considered in a subcommittee. But this is a group of 3 to 5 physicians listening in to the public in the lobby on what they think about the bill. And so this is probably the prime time to actually step up in public and provide that feedback and really call out some of the unintended consequences or the good pieces of a bill if there's one being considered. So they can pass, amend, or reject that proposal, and then it'll go to a committee, which, as I mentioned, is a broader group of legislators, usually 14 or so to 20 legislators from both parties that will debate the bill. This isn't really the public's opportunity to comment. This is the opportunity for the committee that is specialized in that area, like the Health and Human Services Committee, to identify potential roadblocks or the merits of the bill. And so it kind of funnels up to bigger groups each time. Next, it goes on to the full chamber where everybody has an opportunity to listen in and actually vote, usually on their final time on that side of the chamber of the legislature. And so once it passes one chamber, it has to pass the other by going through all those processes again. There's usually amendments, so it does bounce back and forth, and an identical bill has to pass both. So there are a lot of opportunities for IMS and our members to, engage and provide that context as they're considering those proposals. Once it passes both, it goes to the governor, and the governor has the opportunity to sign it into law. All right, that was a lot. The last thing I want to speak to on the process is kind of a fine detail that IMS gets a lot of questions about, which are registrations, how IMS registers on certain bills. To speak to a legislator comment in a subcommittee on a bill, lobbyists must first register their client's position in the Iowa legislature's website. And so the legislature collects all of those registration on a specific piece of legislation and helps the legislators consider, well, there's this many groups opposing it, there are this many groups supporting it, or there are many that are undecided that might have questions about it. And so this slide shows the available registrations. Broadly speaking, you can register for a bill, against a bill, or undecided on a bill. That's pretty much exactly how it sounds for the for and against. For it, you support that piece of legislation and that proposal. Against it, you're opposed to a degree that there is just not a viable path forward, and you want to see that bill stopped. And then we can also register undecided, which is our most often registered position. This is used to indicate really 3 different scenarios. One, to support the general idea of the bill, the general intent, but we want to see a few of the changes. We could be indifferent to the intent of the bill, but seek to comment on any unintended consequences or potential impacts. Or we oppose certain aspects of the bill, but we think that we could overcome that by amending some of the areas that we have the most concern with. And so some of the things that IMS considers when we're deciding if and how to register would be, one, IMS policy as determined by our policy forum process. That's a 7-week process twice a year. That's really extensive and allows our board to vet these ideas. Also, we have a committee on legislation that is comprised of physicians from across the state that really track the legislative front closely and are keeping up to speed on all of these issues, and they provide great context and insight, or feedback from our board of directors, who also often attend those committee on legislation meetings and have thoughts from a high-level strategic position. We also take in a lot of feedback from our members. And so if we get emails from members on a certain piece of legislation, we'll review those and take that into account and often use that in our subcommittee testimony. The 2 other considerations that we also think about are the ability to change the outcome of the proposed policy. Sometimes these bills are going to move no matter what, and we do have to take into account our political bandwidth or the ability to get our other priorities across the line. And so we do have to make those strategic considerations in light of our established priorities that our board, our committee on legislation, and our policy outline. All right, and this is just more of an FYI. Session is approaching. The first day is January 12th, and we're already kind of doing the work to prepare for that. And so it is really important to have this conversation on how to advocate now. There are certain opportunities, many opportunities during the legislative session to engage, but we really do prefer physicians to reach out ahead of time and offer to be a resource, which I'll talk about here in just a second. But we see a big uptick in activity during the funnel deadlines. And the funnel in Iowa is kind of unique to our system of government. It's essentially a procedural mechanism that tries to cut back on legislation that's unlikely to pass, but also speed up the process and filter out some of those proposals. And so we have two funnels. You essentially have to get a bill past a certain point in the process through committee in one chamber by the first, through an entire chamber and committee in the opposite by the second. And so we have to do all of that and keep our bills moving, or kill bad bills before those, use those to kill bad bills throughout the process. The last day is about 100 days during even number of years, 110 during odd number of years. And that's just when, legislators stop getting paid. So we usually go over that, but that's kind of the flow of the session from a 90,000 foot view. We like people to reach out ahead of time, because if you establish that rapport and reach out to your legislators and offer to be a resource prior to session, they're more likely to help you out, because you're not coming with a specific request when things are very busy and chaotic. So keep that in mind, and I'll speak to that a little bit more as we go along here. All right, and now what everybody has been waiting for. Effective advocacy. I'm going to lay out a few of the tools and the importance of advocating. And then if you have questions by the end of this, I encourage you to speak up and we'll address each of those. We'll also show you how to get certain resources that assist in the entire process. So the first thing I want to emphasize is the importance of advocacy and outreach and engagement and being involved in the process. We've seen time and time again that grassroots advocacy and hearing from constituents with firsthand knowledge is the most effective form of advocacy. That's how bills are most often impacted, for better or worse. And so I truly believe if you're going to be in healthcare, you're going to work in healthcare, you should be involved in advocacy, because like it or not, laws will be written whether you engage in the process or not. And having a seat at the table really does ensure that your voice is heard. So I encourage everybody to really think about that and really engage and get to know your legislators, because they are looking for information. And that insight does impact the way that they conduct business in the legislature. I would also say, imagine a world when we don't have an IMS lobbying in the Capitol, or we don't have physicians reaching out to their legislators. You will see a lot of bad policy and a lot of impacts on your practice day to day. So I do think it's really important that everybody engages and is active in the process, which IMS is here to help with. All right, and so a few ways that physicians can get involved, or members can get involved, that people should get involved in the process. As I mentioned, getting involved early prior to session when the legislators are very busy and they're considering a lot of different proposals is preferred. I am a strong believer that relationships are built in the off season. So if you can reach out ahead of time when you don't have a specific request, that will carry more weight, and the legislators are more likely to remember that. So before session, I would encourage you to introduce yourself to your legislator. Usually email is the preferred method. If you get to know them, you might have their phone number, or you might write them a letter. So those are a couple mediums you can use. I'll talk a little bit about how you can get some of that information to introduce yourself and reach out. If it is before session, I would encourage you to either invite them to coffee or host them at your practice site. If you have the ability to meet with them face to face, they're more likely to get to know you on an individual level, to build that trust. And if you are at your own practice site, you really do have the ability to show them, this is what I do on a daily basis, and this is why certain things are more important, or certain considerations need to be taken into account. So seeing that and being firsthand in your practice site, I think does help quite a bit. Otherwise, coffee is a very relaxed setting and they're used to getting coffee or another form of drinks with constituents. So take that into account as well if you're not able to bring them to your practice site. And lastly, I think the most important thing you can do prior to session, even if you don't meet with the legislator, is just offer to be a resource, an ongoing resource, once session comes around. They get a lot of information and proposals that they have to decipher, and many of these lawmakers are not in the healthcare space. And so having that background and that insight and having the contact and you as a physician does help to a huge degree because they'll think, oh, I talked to this person about XYZ topic, or they work in this field. They might have some good insight. I'm going to reach out to them and see how it's going to impact them. So reach out ahead of time and just be there as a resource if they need it. If you don't reach out ahead of session, don't worry about it. You still have the ability to advocate and help out and still be very impactful. So during session, I would encourage you to keep your legislators informed. A quick email on a specific bill does go a long way. They will take that into consideration. And they may receive a ton of feedback and emails about a certain piece of legislation. They may not get any but yours. And so I do think it's important if you have the ability to, if you have the ability to reach out and provide that insight, to do it. The best way to stay up to date on what proposals are going through, because as I said, there were 2,300 introduced. Subscribe to IMS's newsletters and some of our advocacy alerts. We have an action center that we provide a lot of those updates, especially when there's a bill that we are really actively engaging on. And so staying kind of in tune with what's going in the legislature through some of those updates is the best way to update your legislator and let them know this is important to me. Another good avenue to engage is through legislator forums. Lawmakers always have set aside panels or speaking engagements in their district during the legislative session. Usually these are on Fridays or Saturdays. They'll invite the public and they'll allow you as a constituent, a member of the public, to ask questions about certain pieces of legislation, certain issues that are important to you, and ask them questions. If you're considering a certain bill, it is good to get their feedback on how are you sitting on this right now? How do you feel about this proposal that was just introduced? Or, hey, I saw this proposal that IMS is tracking. What are your thoughts? They'll, one, engage and give their perspective, but they'll also take a lot of feedback at those legislator forums. And so we do provide those, a link to all of the legislators' forums across the state during session that you can keep up to speed with and go and engage on. And then lastly, our flagship advocacy event, our big advocacy event, is Physician Day on the Hill. This is a great opportunity to show strength in numbers. And so I will spend some more time speaking about this in a second, but that is the one opportunity. If you just go to this legislative session to the Capitol one time, this is probably the time to do it. But before you do any of that, the first step that you need to take would be contacting your legislator and figuring out who your legislator, who your lawmaker is. The Iowa legislative website provides a really, really good tool to figure out who your lawmakers are and how to contact them. That'll say, your state representative, your state senator, and then you can also find federal lawmakers as well. So the link to this tool can be found on the IMS advocacy page on our website. Christina may have it handy to drop the link in, possibly. But all you have to do is enter your address and click search, and your representative, your senator, and their email address will populate and allow you to read about them. It'll tell you what committees they're on, subcommittees that they're involved in, and that kind of shows, how engaged they are on healthcare or the issues important to us. So I do encourage all of our members to use this to identify their elected officials when they're either trying to figure out whether they can call them, whether they're trying to email them, or if they're scheduling time when they go into the legislature at the Capitol to meet with their lawmakers. This is really a good tool to use and to be aware of. And this, like I said, this can be found on IMS's website. And so I'll reiterate this. I believe there is significant strength in numbers when it comes to advocacy, and intending, these in-person days on the Hill, particularly IMS's Physician Day on the Hill, is the best way to meet your lawmakers where they are and capitalize on a single shared message. These events have proved to be incredibly effective for IMS and other groups in accomplishing, what their legislative goals are, because it really does demonstrate strong grassroots advocacy to lawmakers at one time. When all of the physicians walk in their white coats and they're all talking about the same issues that they're facing, that is palpable, and it really does resonate with the legislators, especially when they have their own constituents there. And so making sure that we have somebody from each corner of the state is very important. And I think the Physician Day on the Hill is the best opportunity for physicians to engage directly with lawmakers, share their expertise, and ensure that we do have that strong unified voice. And so you can scan to register for February 17th. I think this is a great opportunity. You can go ahead and get that out of the way. But I encourage everyone to engage because we do expect many public health measures. And so even if you are not able and your schedule does not permit you to attend a one-day event, you are able to attend or go to the Capitol on your own. And I do encourage you to do this and talk to legislators face-to-face about whatever issue, whatever bill you are interested in. So I do want to provide that information on how to go in person and get into the Capitol, because being able to navigate the building confidently can really reduce a lot of stress and open-ended questions to ensure that the conversation goes more smoothly and you're more comfortable. So to start, you would need to enter the building at the ground level, and there are 2 entrances on each side. So you'll enter there, go through security, and you'll be in the cafeteria area at the basement level. And once you are at the center of the cafeteria, you're going to look for the staircases that take you upstairs 1 level. Once you're upstairs into the rotunda area, you'll see this view. If you didn't coordinate with your legislator ahead of time, no big deal. You can go upstairs through these stairs over here to take you up to the area where most of the legislators will be. Once you get up there, this is what you're going to see. Go towards the dome area where you will find a big picture with a table set up outside of each chamber. And this is the seating chart for each of the legislators. On those, you will see a pink note card that allows you to put that in and write a note to your legislator. I'm saying, I am here. I hope to talk about this issue. Please come out and see me because I'm by the doors. And so you'll look for those pink note cards, fill out all the information they have. And after you turn it in, you'll just wait there for your legislator to come out or until the clerk, the person that you hand it to, returns with the legislator. This is probably the best way to reach out to a legislator if you're in person and you don't have their contact information. They like to meet in person. So just say, I'm interested in this topic, and I'll walk you through the steps of this. But this is a good mechanism to use once you're there. And those are the pink note cards you're going to be looking for. All right. Once your legislator comes out, or even if you're not meeting face-to-face and you're talking over the phone, I'm going to walk you through kind of the step-by-step guide to use when you're talking to your legislator. I find it really helpful to have this basic framework that you can fall back on when delivering your message, so you don't get lost trying to describe all of your thoughts and feelings on a particular issue that you care about. That'll avoid a lot of frustration, and it'll avoid, honestly, you from rambling, which can become an issue. So with that, I always fall back on this kind of 5-step framework. 1, introduce yourself. 2, state your purpose. 3, provide any relevant background. 4, make your request. And then 5, say thank you. So for each of these, as you introduce, I'll go through each of these briefly, but I would try to commit that to memory as you're going through and talking to your legislator, because you have to print this off and look at it. It makes it a little more difficult. But if you can have that in your back pocket, I rely on it, and it helps quite a bit just to keep you moving throughout the conversation. So 1, when you introduce yourself, say your name. but also tell them your practice setting, or if you're a student, your school, and say, this is where I'm coming from. If you're a constituent and you live in their district, that is critically important for you to tell them, because they listen to their constituents above anyone else. You ultimately elect them, you vote for them and put them in their seat. And so you should identify that at the front end and say, hi, I am Seth Brown. I am a member of IMS, and I live in Polk County. I'm here to talk to you about some issues that you're considering that might impact your district. So really important to get that introduction out of the way. Second, state your purpose. Usually, if you're there with IMS, it's Physician Day on the Hill, and you can say, I'm here for IMS's Physician Day on the Hill to talk about healthcare issues. If you're there on your own, you can say, I'm here to talk about prior authorization. I'm here to talk about the physician workforce. I'm here to talk about loan repayment. I'm here to talk about public health and access to vaccines. It's really important to just come out and say, this is what I am focused on. This is important to me. And they have that right away. Sometimes, they're in a hurry, and the last thing that they really grasp are like, what am I hearing about? What did that person talk to me about? And so just get that out there and say, this is why I'm here. Sometimes it's also the bill number. If you have a specific bill that you want to say, I'm only here to talk about this. Next, 3, provide background. This is usually where people can get a little lost and start to ramble. So it is really important to have, I would say, 1 statistic, maybe 2 at most. Get that out and just say, here are some of the facts. But I have found what resonates most are brief examples or stories that have impacted you specifically. If you are able to quickly and efficiently recite those and really drive it home, that is the most effective way to do it. Usually it's a patient interaction, or it's the impact that a certain piece of legislation has had on you or someone you know. But getting that story out, that personal anecdote, does help. And I would say sometimes you do get lost in that. And I would fall back on your talking points. IMS does always provide talking points for the issues that we're asking our physicians to go talk about. These are vetted and they work. And so if you are lost in the conversation, your framework is slipping your mind, have those talking points ready and just be able to recite some of those things that IMS or that you have put together that would resonate with the person you're talking to. 4th, I would say it is not rude to specifically make a request that asks and make sure that they know exactly what they can do for you. Be upfront with that, put it out there, and make sure they know ultimately what they can do to help you as a constituent or a concerned citizen. Again, those are usually on the talking points and they should be considered and factored in. Just have that ready. IMS and other organizations usually do provide leave behind materials. And if you're going in on a certain issue, I think having something brief that summarizes the issue as well as what you talk to them about on hand is really important. Sometimes they're in a hurry and they have to go. These are very busy people. And having that leave behind that they can consult later does help a lot. So have that leave behind material ready in addition to your talking points. And then lastly, this might be the most important thing. Say thank you. Make sure you recognize that they are public servants. They are volunteering their time for the most part, and they want to do their best. They're trying to do their best for you. So a brief thank you does go a long way. It doesn't have to be much. It doesn't even have to be that sincere, but if you say thank you for your service, they do remember that. All right, so that is the basic framework. If you want to get into the weeds, I would say to effectively advocate, here are some of my pointers, and these are some of the things that have helped me as I'm having these conversations, just to keep in the back of your mind. And all of this comes after quite a bit of practice. And so I should probably add a bullet that says practice, practice, practice. But once you get that framework down, here are some tools that you can use on delivering your message effectively. First, I would say balance being concise, but also respectful. Acknowledge that the legislators do have a lot going on. They're busy, and you should keep it simple. Don't confuse that with being short and curt. I would say make sure that you get your message out in a polite way, and say it respectfully in a way that they're going to remember. So be concise and respectful and try to balance that. Two, I'll say it until I'm blue in the face, use those talking points. They are effective, they are vetted, and they do work. There's no shame in kind of rehearsing that ahead of time and making sure that you have those on hand. Next, like I said, tell your story. Bring those personal anecdotes, those examples to say, this is what this bill does. This is how it's going to impact me, my patients, your constituents. Having those personal real world examples really does sit in the mind and resonate with legislators. Lastly, if you're going to say one thing, say what the request is. Have the bill number, have that specific ask, either, support House File 303, please defeat SF 180, don't vote for this bill. Have that request on hand, know it, and have that ready to deliver as clear as possible so that they know what they can go back and do. And then lastly, make sure you breathe and just take a second to, make yourself comfortable, because you should go into those conversations very confident. At the end of the day, you are the one with all of the information, and those legislators need that information to make an informed decision. They want the background, the insight, the expertise that you have. And so I would encourage you to go in with that confidence, knowing that you can really help this legislator out, because they will recognize that. They may not always listen to you, but they do want your insight, and that will impact the way that they think about a certain issue. And the last thing I will say is IMS's website is really the home base for all things advocacy. So go to the advocacy page, you can scan it here or just go straight to our website. We provide a lot of resources that are helpful, that I would encourage you to consult before you call your legislator, email them, or show up at the Capitol. You'll find links to our Grassroots Advocacy Action Network, where you'll get notified about bills that have been introduced. You'll receive updates on and resources and insight on bills that we're tracking. You can also find information on our Iowa Medical Political Action Committee. Dr. Yakub had a great quote on this slide, so he obviously sees that as a great opportunity. It does have a big impact on how we effectively advocate. So if you can't find what you're looking for on this page and the advocacy resource page, you can email me. I'm always available. I'm happy to answer any questions you have or discuss ideas back and forth. With that, I've been talking a lot. I will open it up for questions.
Fantastic. And thank you so much, Seth. We do have several questions in the chat. First off, Dr. Yakub asked, how much are they paid, and what is their terms?
Legislators in Iowa are paid about $25,000 annually for the public service that they provide. There have been bills that have been introduced to increase that, but they typically don't pass, mostly because it is a public service, and most people want to ensure that it's not a full-time job for those legislators. So right around that amount for those serving in the legislature. The second part of that question was terms. Iowa does not have term limits. Some states mandate legislators can serve for 1 term, 2 years, 2 terms, or so many years. Iowa doesn't do that. Iowa has taken the stance that the democratic process essentially should serve as a term limit. You can vote that individual out each election period, each election cycle, and that's ultimately the one way to get a new legislator or not. So a lot of states have different stances on that.
Fantastic. Thank you for that. Our next question I actually have as well. What is your recommendation for a good resource to summarize who's on the ballot and what measures are up for vote?
Yeah. Ballotpedia is a good overarching resource that most of the public uses. I would say that's one easy one that you can Google just to figure out what issues are important to a certain individual. Sometimes Wikipedia is just as good. You can get a lot of their background online through that. What I would recommend, if you have questions about a specific legislator, email me. I'm happy to talk about their healthcare track record, especially if they're an incumbent, or what I've been hearing about certain legislators that are running for the first time. Our Iowa Medical Political Action Committee board really tracks this closely. And so if you get on our website and look at who is on that board, a lot of those individuals would be good to consult as well. Sometimes IMS will put out legislative guides, but we haven't done it for a long time. Mostly because we work a lot with the incumbents, and sometimes getting involved in that can backfire. So we are cognizant about how exactly we engage and how we put out public messaging on certain things. I'm happy to answer questions about specific legislators though, and I will be unvarnished and truthful in that. So feel free to come to me.
Around that same guys, Dr. Coop also asked about dropping in unannounced. Do you have a recommendation on if there are particular legislators that would prefer an in-person unannounced request or via email?
Some are better about that than others. I will say it's probably best practice to shoot them an email, or if you have their phone number, let them know ahead of time, I'm going to be in the Capitol this day. Sometimes they can move their day around to meet with you. With that being said, they're used to people just showing up to the Capitol and talking to them. And so if you don't have their contact information, or if you decide last minute to stop by the Capitol, totally appropriate to just put in one of those notes and say, hey, I'm here, I'd like to talk to you about this issue. As I said, some legislators are better about coming out and talking to constituents than others. I won't necessarily say who in this setting, but usually based on one visit, you'll kind of know, okay, they've been good with coming out and talking to me or not. I think the best way to prevent that would be an email ahead of time.
Fantastic. Thank you so much for that guidance. I think I hit all the questions in the chat. So what other questions do the folks in the room have?
Yes, Health Advocacy. I'm still puzzled by the time commitment they have to do and the limited pay they get. How can they make living? I mean, to me, it's their session is long, it's awkward. You're telling me they're available, for a significant amount of time for me to show up and drop by to get paid 25,000 is might as well not getting paid at all, actually. How they make it?
Yeah, a lot of them, well, they're considered part-time legislators. And so most of them do have full-time jobs outside of their work in the legislature. And that can, really span the board. You have a lot of farmers, you have a lot of small business owners, you have a lot that have flexible schedules. So it does attract a certain type of person to run just based on their ability to actually show up every day during session. So I would say that impacts it. You see a lot fewer healthcare workers, people in the healthcare space because of this, because the time demands are really difficult and the pay isn't great. The pay side, it really is about being perceived as a public servant, and it certainly does attract certain types of individuals across the state, those that have a little more autonomy in their work schedule. I think the biggest constituent group in the legislature right now, which is reflective of Iowa, is farmers. Our farmers, they have certain busy periods where they're planting and harvesting, but for the most part, they are able to kind of set their schedule. As I mentioned, you also have a lot of small business owners that are able to hire a staff to do a lot of their work, but it does prohibit a lot of people from being able to be in that setting.
That is concerning, actually, because you have to be either
As I can tell you, we have a real focus on getting physicians to run, though. We do have 2 physician legislators in Iowa at the state level in the House of Representatives. So it can be done. And I would certainly encourage physicians to run. The more we have in there, the better, because they have insight that most people don't. And so it can be done. And I think that's where we need to start, is trying to get our people elected.
Thank you.